Sometimes patients will say, look, Dr. Lancer, why is my complexion always a problem with breakouts? So there are many reasons why people get blemishes, and usually lifestyle is the number one reason. Age, hormonal predisposition, genetics, lifestyle. And lifestyle means what they're doing for activity, whether they're worried about everything, whether they can relax, whether or not it's an individual who exercises a little bit. Maybe it has to do with diet alone. What you eat is extremely important in complexion. I know a lot of my colleagues in the dermatology world don't think that's true, but I can tell you it's true. Stress can be a significant component in blemish formation. And the word breakout means blemishes, and breakouts to some people are 1 or 2 blemishes. To other people, it's thousands of blemishes. Sometimes it's only the face, sometimes it's the chest, the back, the butt, the legs, somewhere. But blemishes are oftentimes stress-related because it influences the neuroendocrine or the psychology of hormones. Stress comes in multiple forms. There's physical stress, emotional stress, psychiatric stress. There are all sorts of forms of stress, and like an illness alone is a form of stress. So stress means that there's a neurologic component leading to a hormonal shift. And cortisol is part of it, testosterone is part of it, estrogen is part of it, thyroid components are part of it. So the stress influences many hormonal components of an individual, and that can easily lead to blemishes. So if an individual gets blemishes and there is no pattern, a monthly cycle, a work schedule cycle, a public speaking cycle, then it may have to do with some sort of internal health issue. Maybe their body is hormonally imbalanced, and that may have to do with, it could be a brain issue, a pituitary gland issue. It could have to do with an insulin issue. So once you get chronic, unpatterned blemishes, and they're significant, they're serious enough in terms of the extent, then you should see your dermatologist, and the dermatologist will evaluate if there's something else that needs to be checked for, and in some circumstances, they'll recommend an internal medicine examination or a specialty. It might be a gynecologist, it could be an endocrinologist, it could be a psychotherapist. So oftentimes the dermatologist that you're seeing will get the drift as to what is the story. Sometimes a patient's behavior during an examination will give an experienced dermatologist a clue as to where to look. When an individual starts to develop a blemish potpourri of symptoms, it depends on where it is. So for example, let's say the blemishes are on the back, and they will determine that, well, you know, I've started to do all of these mat exercises. Maybe the heat, sweat, perspiration, and the exposure to the synthetic nature of the mat is triggering the blemishes, and it's not hormonal. It is not lifestyle involved. An individual will oftentimes have a clue as to what the problem stems from, and then they'll share it with me, and then I'll say, well, this is how you deal with it in order to sidestep repetitive blemishes that can leave scars. I always tell patients, blemishes can occur in a newborn. The newborn pops out of the mother's womb right away, neonatal acne. So you have a newborn popping into life for the first day or so, blemishes. Well, that's probably from placental hormones, most likely. But nonetheless, you can have blemishes at birth, you can have them when you're 15, you can have them for the first time when you're 70 years old. So the good news is, There's a variable onset, but they almost always have a solution when you start looking for the cause. So there's always a solution, and it's curable.